Hello and welcome to Vet's Eye View. Today we're talking about grooming needs for your pets and more. If you haven't already, like and subscribe to our Facebook and YouTube channel. And with that, let's jump right into the first patient.
You gotta check me out first. Yeah, you gotta check me out first. All right, you're done checking me out. That's all right. So what we will do is a complete exam to make sure we know how everything is. Chip is getting the Bordetella vaccine today and also updating heartworm preventative. Good. Have you noticed any sore spots on the body, lumps or bumps?
No.
Good. Right, Chip. I know. Why do they want me to sit still? I'm an excited, moving dog. Let's check you over, huh? There we go. Any change in the amount of tearing that spills over onto the face?
No, he always just has tearing.
Okay. Does it ever irritate the skin? Or are you able to get that nice and clean with a washcloth cleanup periodically? Okay. Epiphora is the name of that. It's just tear spillage over the face, and it is common in some breeds of dogs. Sometimes the hair acts as a wick to pull it over. Other times the tear duct actually has a blockage and it just overflows onto the face. If ever you think there's asymmetry to it or it's not something that you want to deal with, there's a potential to clear the duct by flushing it, and that sometimes can open things up. Other times it's really just that the duct didn't form well, and that there isn't really anything that we can do about it except keeping it clean. Do you know whether your groomer ever plucks the ears, or do they have an opinion about that, or have they shared anything about that? Because there's a lot of hair in the ear canal, and I want to make sure that they remove that hair.
Yeah, they do. So they might not have the last time I groomed.
That's all right. So when I lay the ear skin flat, all of the hair that stands up in the middle is actually growing out of the inside of the ear canal.
Okay.
And so that is hair that is typically plucked by the groomer. Okay. And so that's been growing for some time. So I just want to make sure that they do pluck the hair out of the ear canals. Okay. That gets things back down to where they should be. Okay. Hair blocks the flow of air, and that's what results in those ear infections. Okay. When hair grows in the ear canals, it's normal for it to occur in some instances, but the way we've changed breeds of dogs, hair will grow in unusual places. And so when hair grows in the ear canals, it blocks the flow of air, and that is what keeps air from keeping the ear canals dry. And when they accumulate moisture, then bacteria and yeast that live there in small numbers, they'll kind of multiply and start an infection. And so we want to get the hair out of the ear canal today for this pet, but it's really a good idea for groomers to go ahead and remove hair from the ear canals on a regular ongoing basis for prevention. Here we're intervening with an active inflammation, but we want to do it on a prevention basis at home with the groomer.
Great. So when it comes to the groomer, how often should animals get groomed, or does it depend on the breeds?
I think most of the time, when there are some breeds of dogs that don't have continuously growing hair, but those that do, that interval is probably close to 6 weeks or so. Some people will wish to have their pet groomed at 4-week intervals, sometimes at 2 months, other times they'll let them grow out during certain seasons but keep them short in others. But the rate of hair growth is, and personal preference for their own pet is probably where the determinant for the interval comes from.
Okay, so when it comes down to this becoming an issue for the animal, what are some signs that you can tell from as the pet owner?
I think itchiness with the ears. Sometimes people will notice an odor. This gentleman didn't notice the fur in the ear canal as being the issue, but he noticed the scratching. And I think if we're tuning into those subtle signs at first, coming in for an examination, we can see whether it is one of these kinds of issues with fur, or something got stuck in the ear canal, or whether there's an underlying issue like allergies, or they went swimming and then they got moisture in the ear canal from that reason. Lots of things can start a domino effect in the ear. Looking for what its effect is, but maybe getting a clue as to what started it are the ways in which we can get on top of it and prevent it.
Now, is it more common for a dog who has the ears that kind of flop down instead of straight up? Is it more common for that type of dog to experience this issue?
Exactly. So when nature created dogs in the first place before we changed them, there was a 30-pound dog, upright ears, short hair. They didn't grow hair in the ear canals, but our desire to have puppies look like babies, and long hair and short hair and no hair and all sorts of other differences, we kind of created some issues that make them a little bit more prone to having this. And the floppy ear definitely covers the opening of the ears, making, again, less airflow into the ear canals.
blockage is just the cyst issue, and I'll have you take a peek at that spot, make sure it's healing okay.
Very good.
But
I did not review that, so I'm trying to remember where that was.
I think she looked it up, it was his right hip.
Okay.
I said it's healed so well, I can't even tell you which one
I like that.
he had, but
That's very good, my friend.
he's a sweetheart.
One of the other comments I would have is, and CD is notorious for this, is these pouches right underneath. He just feels like he's full in his weight, and CD has that tendency sometimes. Now, I don't know whether he's been trending upward with his weight, but
A little bit, yeah.
I want you to know that WD, Prescription Diet WD, also
Yeah.
made by Hills, has all of the properties for urinary control, but it's lower calorie. If you feel like you're getting behind, or you want to reduce the amount of CD, but he doesn't like that, then we can go to the WD. So the volume is the same, but the calorie content is lower.
Okay, because yeah, I have a horrible time trying to get him. I've never had a cat that I've not been able to at least keep somewhat under control with
Yes.
weight, and I've just not known what to do because I can't change his diet to
No.
anything. So
Yeah, this is a very common thing and a common predicament that people feel, because CD is very, very good at what it does at controlling the urinary crystals, but it does taste so good. And you lower the amount and they say, wait, I feel kind of empty, and it leaves you feeling like you don't have options. But WD, not so much that you go back and forth, although that's kind of okay. If you made a change because CD was just putting on the weight, but you want all of the urinary benefits without the calories, use that. You can probably make a gradual transition over a 7 to 10 day period
right.
onto WD and use that. And if the weight settles down, it's not a weight loss food. It's a higher fiber content, lower calorie food, if you will. And but that will basically even out when we're down to the ideal weight. There is a prescription diet called RD that is for weight loss. That's even further down the extreme. We're not needing to do that.
No, but if you can add that WD onto his prescription,
Approved. Absolutely.
so that maybe I can move some of this dry food, because he gets a little dry food at night. He gets
Yes.
canned food in the morning, so that I can get his Cosequin into him.
Excellent. That's a good idea.
So we had Pages, the cat that came in. What was the reason for her visit today?
Well, the unique thing about Pages, first of all, it's 2 years old. It's a nice young cat, but experienced kidney problems rather suddenly about a week ago. So Pages came in today for some fluids to help with hydration. Kidneys are a really important organ in the body, as I'm sure you can imagine, and they have so many different functions. And one of the issues is that if they can't get rid of poisons and toxins, they build up in the bloodstream. And one general principle about how fluids help is the philosophy of dilution is the solution to pollution. So if there's pollution in the body, basically, and we give fluid hydration, it really has a diluting effect, but also hastens the clearing from the body of some of those toxins that have built up.
Gotcha. So what are the pure functions of the kidney?
Kidneys have a real important job of keeping water in the body while getting rid of poison. So in the most basic sense, if you think about the opposite happening, poisons are building up in the body and they can't keep water in. Some of the signs of kidney failure is that they're making lots of urine, they're drinking a lot to make up for all of this loss of water, and the toxins that build up in the bloodstream then also cause them to feel ill. And I'm just going to say it generally like that because it could be nausea, vomiting, diarrhea, lack of appetite. Sometimes people will notice a strong odor in the mouth, but those are some of the main functions. But the kidneys actually have a lot of other functions as well. And who would think that these organs would have this kind of purpose? But they're also involved in converting vitamin D into its active form. It's involved in managing blood pressure in the body. The kidneys make a hormone that helps maintain red blood cell production for oxygen circulation in the body. And yet, we don't even need 2 whole kidneys of function to be able to survive. We can donate a kidney to somebody else because we don't even need 50% of our kidney function. That shows you then how significant kidney failure is then, that they've lost more than 50% of their function before they're ever showing signs of illness. So pets may often show signs of a cough at home, and that is the interpretation of somebody who observes this, but a cough and a gag and vomiting, those kinds of signs are easy to confuse, and so it's important to differentiate those. And we're going to kind of look at a couple of videos today that help us to figure out what some of those presentations might look like and talk about some of the things that might be causing it. So with Lucy's situation, she had more of a simple cough. There wasn't a lot of moisture to it. There wasn't a series, or paroxysms as we call it, of coughs that happened. It was a single episode. And it may be that this video doesn't show all of the episodes that are happening at home, but as a single episode, this is more on the simpler end. A cough could be, again, something that is more on the simple end. I've got some fluid, I've got to clear it. We cough every once in a while, same kind of thing. But it could be also the tip of the iceberg, which means that it could be just a mild showing, but there's really something bigger going on. The pattern then makes a big difference. I also think that some situations might just be simply mild. So a mild situation might be something that is on the not normal side of the spectrum, but doesn't necessarily amount to something that is going to be clinically significant. We'll sometimes get irritants. It's normal for us to have to clear that. We might get a mild infection. Again, we normally have to let the immune system kind of let it run its course. So mild is the third possibility. So Kona definitely was showing a cough evident on that first video clip. The second one, however, had more of a series of coughs as well as almost a gag-like reflex, and you could hear a lot of fluid sound during that process as well. It's a little bit more unclear as to whether this is just respiratory or whether we in fact have something in the parallel structure of the esophagus. So cough starts by trying to expectorate or bring up something or deal with a tickle that's going on in the respiratory tract, and we know at least that that is going on, but we don't know if the neighbor, the esophagus, has something in it that is also trying to be brought up. Many times they'll either cough or gag or a combination of the two to kind of clear whatever they're feeling in the throat area. And from a diagnosis standpoint, that's about as far as we can go, but there are some things that can cause these types of issues. If there is a fluid buildup in the respiratory tract, of course there's a natural clearing process that occurs, but that clearing process brings it up to a point where it's ticklish, and then the result is to cough and then swallow. We may not like it, but that's exactly what nature is telling them to do. But the things that cause that fluid buildup differ. There's normal clearing, and then there's things like congestion in the respiratory tract. And of course, it brings to mind things that might be unknown. There could be some infections, certainly. There could be conditions that are causing moisture buildup in the lungs. There could be unusual situations like heartworm that's causing lung issues where the lungs feel wet, heavy, and there's some coughing involved. But when they cough and bring this up, it's not clear as to what started that tickle. The reflex, though, if there's a lot of material, is to get into this gag. A lot of people have had such a significant cough that they gag afterward, and that gag can be so significant that they actually feel like they're going to throw up afterward. So it's important diagnostically at home, as you're getting a description, to figure out, is this a cough that resulted in a gag? Or is this a vomiting episode that resulted in coughing? Cause and effect are really important to differentiate, and that's what your veterinarian will do too. So when we're evaluating signs, it's kind of like going to a theater where the curtain is closed. We might not know what's going on behind there, but we can hear it, we see it, we smell it, this kind of thing. And so we can infer, based on the signs, what might be going on there. But until we actually open that curtain, we don't really know what's going on behind there. And that opening the curtain analogy applies to tests, whether it be x-rays, using a scope to go down into the respiratory tract, or something as advanced like a CT or an MRI. But these kinds of things will help us to identify what might be lurking behind that curtain that the examination or that the signs don't tell us entirely.
Thanks for joining us today on Vet's Eye View. We are trying something new. If you have a concern with your pet and you'd like Dr. Visser to take a look at it and diagnose in future episodes, message us on Facebook. So hold on to your leashes, and we'll see you next time on Vet's Eye View.